This video will cover basic post-operative instructions that can be referred to after your surgery. Typical post-operative symptoms include, but are not limited to, the following: tingling, burning, redness, and/or tightness at the surgical site are all normal experiences after surgery. These are all part of the healing process. Pain medication can help you cope with any discomfort or pain at or around the surgical site. However, consistent sharp pain should be reported to our office immediately. It is also common to experience minor discomfort at or around the areas of surgery, especially if you have an incision or drain at that area. This will also improve with time or when the drain is removed. Shiny skin or itchy sensation on or around the surgical site is not uncommon. Swelling can cause the skin to appear shiny. As the healing process advances, you may experience itchiness. If the itchiness becomes persistent, you can take an antihistamine such as Benadryl to help alleviate any constant itchiness, but remember not to scratch the area. If the skin becomes red or hot to the touch at any time, please contact our office immediately, as this could be a sign of infection. Raised or puckered appearance of a surgical incision is also normal. You may notice that your surgical incision does not look flat. However, this is a normal post-op finding, and your incision will smooth out over time. Leaking, oozing, or seepage from a non-facial surgical incision is also normal. Fluid will escape from the path of least resistance after surgery. A woven or mesh gauze may be used to absorb the excess fluid at the surgical site to prevent any seepage onto clothes. Depending upon the amount of fluid, you may need to change the gauze pad regularly to keep the area dry and clean. Diminished sensation on or around the areas of surgical site is expected. Sensation will slowly return as the nerves begin to reinnervate after the surgery. During this time, it is important to avoid excess heat or cold, as you may not be able to feel if the area is too hot or too cold during the recovery process. Please call the office immediately if you experience any of the following symptoms after surgery: a high fever over 101 degrees Fahrenheit, severe nausea and vomiting, consistent dizziness or incoherent behavior such as hallucinations, any pain that cannot be controlled by your pain medications, bright red skin that is hot to the touch, a foul odor or purulent drainage from an incision site, excessive bleeding or fluid seepage through the incisions, any sudden change resulting in a severely misshapen or swollen appearance at the wound site, any new prominent discoloration such as severe bruising or dusky appearance on or around the surgical site. Remember, all of these things should be reported to our office, as they could be a sign of a potential complication after your surgery. On the day of your surgery, please abide by the following instructions. Please plan to have a responsible adult drive you to and from the facility and stay with you during the first 24 hours following your procedure while you recover. Rest, but do not confine yourself to bed rest. While rest is important in the early stages of healing, ambulation is also necessary. We recommend getting up to walk around for 10 minutes every 2 hours time during the daytime while you recover. This will promote good blood flow and help you heal. Keep the surgical site elevated if possible. If the surgery is on your face or upper body, resting or sleeping in a reclining position is best. You can also sleep on a recliner or use several pillows to achieve this position. If your procedure is on the lower body, keep your legs elevated. This will help with swelling and inflammation. Practice good nutrition and avoid excessive salt intake. Fluids are crucial following the surgery, and make it a goal of yours to consume at least 2 liters of water a day. Avoid alcohol and caffeine, as it can lead to dehydration and other more serious complications. Take all medical advice and medications exactly as prescribed. Contact your provider if you have any questions. Care for your incisional dressings if indicated. Your surgical incisions may seep fluid for a short period of time after surgery. It is important to keep these incisional dressings dry and clean. If your surgeon has placed surgical tape or steri strips on your surgical site, they will fall off on their own after surgery. Wear your compression garment and/or wraps as directed. If you are given a compression garment and/or wrap after the surgery, It is important to follow the directions provided, as this will help prevent the formation of contour irregularities and swelling after healing. Do not smoke. Smoking may impair your body's natural ability to heal, as it constricts the blood vessels and prevents blood flow to the area. Do not engage in strenuous activities or do anything that can increase tension on your surgical sites or elevate your blood pressure significantly. Do not lift, push, or pull anything greater than 10 pounds for the first 2 weeks following your surgery. 2 to 7 days following your surgery, please abide by the following instructions. You should have a post-operative appointment already scheduled with our office. However, post-op evaluation times will vary dependent upon your surgery. At this time, you can start slowly easing into your daily activities, but please remember to listen to your body. Once you are no longer taking narcotic pain medications and your range of motion is intact, you are able to start driving at this time. Continue to care for your incisions as directed, and you may shower. Unless told otherwise, you may take a traditional shower, not bath, using water and soap 48 hours after your procedure. Remember not to submerge your incisions in water until they've fully healed. Avoid direct water pressure on all surgical areas unless otherwise instructed by your clinician. After you get out of the shower, remember to pat the areas dry with a clean towel and change your sheets regularly. If your surgeon or clinician has advised you to use a post-operative cream or serum, you may do so. If you have steri strips or surgical tape atop your incisions, you can still apply the products atop the porous tape. Take all medications as directed. You may take your prescribed pain medications or use over-the-counter Tylenol to ease post-op pain or discomfort. Remember not to exceed 4,000 milligrams of Tylenol or acetaminophen in a 24-hour period, and avoid NSAID products at this time, such as Advil, Aleve, ibuprofen, or Motrin, unless otherwise directed. Practice proper sun protection after surgery and avoid sun exposure to the surgical sites. If you must go outside, remember to wear protective clothing, a wide-brimmed hat, and SPF. In terms of exercise, stick to light indoor walking at this time. Walking is essential to prevent the formation of blood clots and post-operative stiffness. Try to have a bowel movement within the first 24 to 48 hours following the surgery. If you are having difficulty, you may try over-the-counter Miralax, milk of magnesia, or magnesium citrate. Please contact our office if you are still not successful with these measurements. Remember to maintain a healthy, low-sodium diet. Intake at least 2 liters of water per day. Do not smoke, do not consume alcohol, and avoid caffeine at this time. 1 to 4 weeks following your surgery, you may ease back into your normal daily activities and continue following the aforementioned guidelines. Any discomfort, tightness, or tingling that you are experiencing will resolve with time. At the 6-week mark following surgery, there are generally no restrictions. At this time, it is okay to resume sexual activity, working out, and even engaging in more strenuous activities. We recommend scheduling a 6-week follow-up appointment if you haven't done so already, so that the details can be discussed with your surgeon. During your first year after surgery, your scars will continue to refine over time. A scar's 2 worst enemies are sun and tension. Therefore, we recommend practicing good, healthy nutrition, fitness, and sun protection. As you continue to recover, your body will begin to feel more normal over time. We recommend scheduling a 6-month follow-up to check in with your physician or surgeon and discuss any questions or concerns you may have at that time. Finally, remember that your skin will continue to age and change over time. Despite having surgery, your body will still follow the natural aging process. Feel free to contact our office with any questions or concerns by calling 713-791-0700, or you may text us at 281-623-1392. Again, feel free to call our office at 713-791-0700 or text us at 281-623-1392. Remember, we are here for you after surgery and wish you nothing but health and happiness as you recover during this time.